Hi, in this video we'll continue talking about the artificial urinary sphincter. We'll talk about the success rate of the procedure, as well as the complication rates and the satisfaction rates. Most studies in the literature report success rates around the 80% of patients who achieve social incontinence. This is usually defined by patients wearing 0 to 1 pad a day. A recent systematic review published in European Urology Journal indicated that the rate of social incontinence is between 60 to 100%. However, the reported dry rate in the same systematic review was much lower than that, and it was around the 43% mark. In terms of complications, the most widely reported complications are infection, and that happens in about 4% of patients. If that happens, the device will need to be removed and replaced with another device after the infection is settled on antibiotic treatment. Erosion is another complication, and this means that the cuff of the artificial urinary sphincter can erode through the urethra or puncture the urethra, and if this happens again, the cuff will need to be removed and the area allowed time to heal, and then another cuff will be implanted, usually in a different place, either more proximally or more distally. This also happens in about 4 to 5% of patients. The third reported complication is urethral atrophy, which means that the urethra underneath the cuff can shrink because of the continuous pressure, and that makes the cuff loose and ineffective. And if that happens, the cuff will need to be removed and replaced with another smaller cuff, which is called downsizing the cuff. These three complications are usually grouped under the title of non-mechanical failure. The other group is the mechanical failure, because if the artificial urinary sphincter is a mechanical device, any part of the device can fail, either the pump or the cuff or the balloon, and if that happens, part of the device or the whole device will need to be replaced. Common reasons for failure are leakage of the fluid via the tubes, or puncture of the balloon and leakage of the fluid. So in total, the rate of revision surgery after the insertion of the artificial urinary sphincter can be anywhere between 14 to 45% of patients. And these reported complications of non-mechanical and mechanical failure consider one of the main downside of the procedure. However, despite needing maintenance surgery within 10 years, most patients are well satisfied after the insertion of the artificial sphincter, with reported satisfaction rates ranging between 85 to 90%. So to recap, the artificial urinary sphincter is an effective treatment for male stress urinary incontinence after prostate surgery, especially severe incontinence. However, the downside of the device is that it has a significant complication rate and interventional surgery rate. Despite that, patients are well satisfied after the insertion of the sphincter, because it does restore patients' quality of life. I hope you found this video useful, and I apologize for the poor quality of the voice.